Are you or do you know somebody who's nearsighted, myopic? Do you need glasses or contact lenses to play your sports? Has your prescription been going up every year? If so, stay tuned to this video. It'll be interesting for you to understand how nearsightedness and myopia progresses, how it can be treated, and some of the new ways we can use to try to control that change and what that means for you as an athlete. Hello, I'm Dr. Laby. I'm a sports vision ophthalmologist with 30 years experience working with professional and elite athletes in all sports. This channel is designed to bring to you, the amateur athlete, what I've been doing with the professionals for the last 30 years, and to leverage that knowledge for you so you can perform maximally in your sport. First of all, let's take a look and understand exactly what myopia or nearsightedness is. Myopia is when you see normally at near distances, near ranges, but you have trouble seeing things further away. Now, sometimes you can tell if you're nearsighted by squinting. If you squint and you see things better, then most likely you're nearsightedness, especially if you have trouble seeing things far away and are seeing things clearly up close. But unfortunately, squinting is not a way we can actually perform our sports and expect excellent performance. In general, myopia begins in childhood, and as you develop through childhood, the teenage years into the 20s, it might get a little bit worse every year. In fact, some studies have suggested that almost 23%, almost a quarter of the world population is myopic, is nearsighted, and it actually is much worse in the Asian descent. Recognizing if you are myopic is critical for two reasons. Number one, it's critical to your sports performance. We already know that vision in sports is an important piece to success. It's the bottom of our sports vision pyramid. And we know the average vision of professional athletes is usually better than 20/20, usually is 20/15, or even 20/12, as is the norm for professional baseball. By the way, if you want to learn more about what 20/20 actually means, or in fact what's the best vision humanly possible, maybe 20/8, take a look at these cards for the videos below, which you can use to look at other videos we've produced to explain each of those topics. The second issue with myopia and nearsightedness has to do with the health of the eye. We know that people, as they get more nearsighted, have a bigger risk of having some eye problems, specifically things like cataract, which is where the lens is blurry and opaque and you don't see through it very well, therefore your vision is affected. You can get a retinal tear or retinal detachment, which could actually devastate your vision and completely ruin it. Or you get maculopathy, which also will have a significant impact on your vision and your sight. All of these issues can be permanent and uncorrectable with vision, things like glasses or contact lenses. These are damages to the eye itself. So as you see, diagnosing myopia early can be important, both to your athletic performance as well as to your overall eye health and visual ability in the future. Okay, so now that we know what myopia and nearsightedness really is, how can we correct it? Well, unfortunately, we can't cure it and make it go away completely. But what we can do is control it to make sure you have good vision, and we have some interventions that you'll see in a moment we can use to try to reduce the development, the increase in the nearsightedness. Let's take a look first at how we can treat nearsightedness. Well, the obvious is to have a pair of glasses or contact lenses. That will do a great job in correcting your nearsightedness and give you back to normal vision, or in fact, maybe even better than normal 20/20 vision. Both of those interventions are great, but most athletes prefer the contact lenses due to the risks of having eyewear on your face in playing your sports and so forth, as well as the effect on the peripheral vision as well. So contact lenses work very, very well if used properly, and they're very, very safe. But simply recognizing that you have myopia and correcting it fully with contact lenses or glasses may not be enough. Because as I hinted, as you get older, people tend to get more myopic or more nearsighted. So what we generally like to do is to try to control the myopia or the nearsightedness, the progression of that over the years. Some research has shown that in fact, if we can cut it back by one diopter or one measure of how nearsighted you are, one click of the dial, we can reduce your risk of having some of those eye problems by about 40%. But before we get into that, let's look at the risk factors for myopia. What puts somebody at risk of developing myopia? Well, there's a couple things. First of all, the younger you are when you start having vision problems and start needing glasses or contact lenses, the more likely you're to have increased progression over the years and get to that point where it could affect your visual system. Another risk factor is your parents. If both parents are myopic, then you're likely to become myopic or nearsighted as well. If you spend a lot of time reading or looking at things up close, it could be a book, it could be your phone, it could be your tablet, even at 45 minutes is a stretch, which isn't that much time, that goes by pretty quickly, that can make you more myopic or nearsighted as well. And lastly, if you're of Asian descent, as we hinted at earlier, you're more likely to become nearsighted also. As I mentioned, as you get older, you become more nearsighted typically. Well, when does that increase in nearsightedness actually slow down and stop? Well, research has shown that at about age 15, about half the population will stop developing nearsightedness. And by age 18, about 77% will stop developing nearsightedness. And by about the age of 21, about 90% of the people won't be changing anymore. Well, those numbers are pretty good, but if you think about it, a 21-year-old is often playing their sport at the professional level, and they have still 10% changes in their nearsighted progression and prescription. Well, even if you're not nearsighted at all, if you develop a small amount of nearsightedness at age 21, that can have a significant effect on your sports performance. That's not a great chance of that, maybe about a 10% chance of that happening, but that's still significant. In another publication, about 45% of the population still had half a number increase in their nearsightedness as they continued to grow and age. Well, even half a number of nearsightedness is significant, again, to your sports performance. All of this highlights the critical importance of having a yearly, really good sports vision evaluation, where your sports vision specialist will check your vision and make sure it's fully corrected at the level that you need to perform in your sport. You know, you may have been 2015 or 2012, you had half a number of nearsightedness developed. Now you're only 2020. If you go to a regular eye doctor, they may say you're fine. But a sports vision specialist who understands the importance of good vision in sports will recognize that that's a problem and will get you some correction that you need to maintain the high level performance that you're used to. Well, now we get to certain ways we can try to control the growth of that nearsightedness. If you already are a little bit nearsightedness, how can we stop it from getting worse, or at least limit it from getting worse? Well, there's actually 3 different ways that we can try to do that. The first way is called Ortho-K. Ortho-K is similar to braces. You know how you have braces on your teeth to realign them? Well, think about a contact lens on your eye to realign or to reshape the eye so that nearsightedness goes away. Ortho-K is not bad, but there are several problems with Ortho-K. Number 1, there's a bit of an increased risk for infection with those contact lenses. Number 2, there's price. The lenses have to be changed periodically. They have to be changed in shape. They're specially designed lenses for your eye, and all of that comes with a cost. It works pretty well, but you want to make sure you understand the whole picture before you go down that path. Number 2 involves the use of what's called a multifocal lens. A multifocal lens is a lens that has 2 different areas of focus or multiple areas of different focus. In this case, it's a central part that gives you your distance vision and a peripheral part that has a different prescription to change the vision that hits the sides of your retina. These lenses are similar to what's used in the past for people that need reading glasses, with a little bit of nuance, a little bit of change in how they're designed. In fact, recently the FDA approved a specific lens called the MySight lens from Cooper Vision. We have a picture of it below, which was designed specifically to control the progression of nearsightedness. The company had to supply studies to the FDA for review, and the FDA found that those studies were good, and that in fact wearing that lens did reduce your increased nearsightedness as you got older. You do have to wear the lenses for quite a number of years so that change doesn't ever catch up to you again, but it does seem to do a good job. Number 3 involves the use of an eye drop. We call this drop low-dose atropine eye drops. Atropine is a drop that's been around for a long time. It's a medication used for the heart. It's used as an eye drop to dilate people when you go to the doctor's office, but that's in the full-strength drop. That's the 1% drop. The drop used here to control nearsightedness is much, much weaker. Instead of 1%, it's 0.01%. It's 1/100th strength from the original drop. In fact, that drop is so weak that it has no effect on dilating your pupil. It has no effect on blurring your vision, which you might have experienced at eye exams before, but it does, that small amount is sufficient to make it so your nearsightedness doesn't progress. So all 3 of these approaches have been found to be effective and have been found to reduce the progression of the nearsightedness. Remember, we talked about earlier, if you reduce that progression by 1 diopter, 1 measure, 1 number of nearsightedness, you can significantly reduce the risk of the physical eye problems to the eye. Well, that's a big difference, not only having a very mild prescription when you're playing sports, but increasing the safety of your vision over your entire life. Which of these techniques you might want to use, you should speak to your eye doctor about. They'll talk about the pros and cons of each one, and you'll be able to make an informed decision. But remember, we're doing this not just to reduce your nearsighted prescription, we're doing this to optimize your vision for sports performance. If you found this video helpful, please take a look at the other videos we have in our channel below, all about vision, sports vision, and how we can maximize performance. Also, please subscribe to our channel so you get notified when we have new videos that are put out. Press the icon, the bell icon, so that you'll get a notification. And please send us any comments down below with any questions, anything about any of the videos, anything we can do in the future to help you perform best at your sports. And don't forget to take a look at our blog at www.sportsvisionbydrlaby.com. Thank you for watching, and here's to good vision.